Hi, I'm Vicki Wessling with City Speaks. City Speaks is a show for our residents. They're a show that has been brought to you by Mayor Rosas, and City Speaks is here for you to answer your questions, to find out what's going on in our community and our administration in our city. Tonight we're here at the Senior Center. We're with the Community Mental Wellness event brought to you by the Chautauqua County Department of Mental Hygiene. We're going to talk to our providers, find out what they can provide for our residents, for our citizens, those who might be in need of help, whether it's addiction to drugs, alcohol, suicide prevention, any kind of emotional or mental health issue that you might be having. These are the people who can help you. So come on down if you're here. If not, we'll give you the number of who you can call and how to get help later on. So thank you. Thank you for watching City Speaks. Okay, we're here with Misty, and she's the program coordinator for the Chautauqua County Department of Mental Hygiene. Misty, tell us a little bit about what's happening tonight. What can people expect?
Okay, great. Yes. We are having basically what you would call a resource fair. And that is where we bring together all of the local providers that provide some type of mental health or substance abuse prevention, treatment, or recovery service. We bring all of those representatives into one room with all of their brochures and handout materials and fun little stress balls and pens and giveaways, and give community members the opportunity to come in and meet them face to face and find out about the different services that their programs offer, find out how to get a referral to those programs, and just kind of put a name with a face and break down some of those walls and get to know each other and just learn about all the great resources that we have here in Chautauqua County.
Okay, and now if someone can't make it here tonight, so they can't see somebody face to face, what can they do tomorrow or the next day? How do they call? Give us the number.
They can reach us at any of our clinics. The number there is, I don't know the number, 716-753-4101 is the number to our main office, and we can give out information regarding any of our clinics or providers that provide prescription medication, anything like that.
Okay, so if you're not here tonight, you can always call. You can always visit any of the clinics. We have one here in Dunkirk on Central Avenue.
Yep.
So visit us. Let us know what's going on. Let us know if you need help.
You can also reach us on Facebook. We have Chautauqua County Department of Mental Hygiene has a Facebook page where you could private message us or leave a comment on there, and we can respond to that as well.
Okay, so if you're not here tonight, contact Misty at Chautauqua County Department of Mental Hygiene. We're here with the Chautauqua County Department of Mental Hygiene, and we're going to talk a little bit about what this department does. We've got the Community Alliance and Suicide Prevention. And Annie, why don't you tell us a little bit about the service you provide and who you are and what your role is with the Chautauqua County Mental Hygiene Department?
Hi, my name is Annie Rosenthal. I'm Public Relations Coordinator for Chautauqua Tapestry as well as Chautauqua County Department of Mental Hygiene. I'm here representing the Community Alliance for Suicide Prevention, and we provide suicide prevention resources and education to the community in Chautauqua County. We also provide a lot of resources like the crisis hotline, and the crisis hotline in Chautauqua County is 1-800-724-0461, and that's a 24-hour line that anyone can call for crisis services. If they are struggling and they need to talk to a counselor immediately, we encourage them to call that hotline or go to your nearest emergency room or call 911.
Okay, so when we talk about suicide prevention, and that really is a hot topic because we have so many people who struggle on a daily basis, and suicide usually comes as a result of all the struggles they're having, whether it's drug addiction or some other mental health or emotional issue. So when you talk about the services that you provide, do you have clinicians or counselors on site to be readily available to speak to somebody if they call in?
Yes, the hotline will directly connect to someone and assess them for their need of emergency. We also encourage people, if they need mental health counseling, to seek out treatment in the area. They can stop in at either the mental hygiene clinics in Dunkirk or in Jamestown. But of course, we also encourage people to look out for each other as well. So if you have a friend or a loved one you have concerns about and you see some signs that you just think they're not okay, feel free to reach out to the hotline as well, or to call a professional to seek help for them.
Okay, now let me ask you a question because people talk about all the time. If you hear something or if you know somebody's depressed or if you know somebody says, I'm just going to kill myself. I'm just ready to die. How do you know if they're serious, if they're not serious? At what point do you intervene?
Anytime anyone speaks like that, you should take it seriously all the time. So if anyone expresses that they want to injure themselves or if they want to take their own life, it's very important that you take that seriously and you take the steps to make sure they get help.
Okay, so it's not a matter of overreacting. So if you have somebody out there and you hear them saying those words, get help for them.
Yes.
And intervene. Okay, and what else do we have here? Tell me your name and what do you do?
Hi, I'm Karen Fody. I'm a clinical social worker at the Department of Mental Hygiene. I'm based in Dunkirk, and I do some clinic work at the mental health center there and at the schools in the Dunkirk school system.
Okay, now you talk about the school system because many of our young people really do suffer and they really do go to school. They're not nourished properly, or they feel left out, or they feel bullied, or they've got all kinds of emotional issues. How do you help the students?
We provide a range of services, trauma-informed and evidence-based services, and that can also include depression, anxiety. We really try to help and mitigate trauma in our community.
Okay, very good. And Misty, do you have anything else that you want to say? We had spoken with you earlier. Tell us a little bit about your role and what it is that you do.
Yes, I am the program coordinator at Chautauqua County Department of Mental Hygiene, and my job is to be an assistant to the director, so I help her oversee all of the different programs that we have, including our clinics that we have in both Dunkirk and Jamestown, as well as our MAT programs and our health homes care management services that we offer to both adults and children.
Okay, so if you're struggling, if there's a problem, contact the Department of Mental Hygiene. And let's see what we have here. We have New York Connects, and this is for long-term services and supports. Now, tell me a little bit. Who are you, and what does that mean?
My name is Rebecca Byzinski Bradley, and we work through Office for the Aging. It's New York Connects is a statewide agency, but they have satellite offices for every county. And what we try to do is we try to keep our seniors in home as long as they possibly want to, as long as they're safe and healthy and happy. We provide services, home care, personal care, Meals on Wheels, Lifeline buttons for emergencies, daycare, social adult daycare. So there's all kinds of different services that we provide for our seniors.
Now, how do you coordinate here, or do you coordinate here with our senior center and with our Department of the Aging here?
We do coordinate. So we have 3 offices. We have office in Jamestown, Mayville, and in Dunkirk, New York. And all 3 of the offices do basically the same duties. The New York Connects is the basic intake line for all the data entry. So we'll take your information, find out what services you need. If we cannot help you, we will find somebody that can help you.
Okay, so basically, if somebody needs some help as a senior, or if they have a parent or a loved one who's a senior and they need some help, they should give you a call, right? And what number would they call?
716-753-4582. That will get you to the Mayville office, directly to our New York Connects office. But I also would like to say that we not only help seniors, we will help anybody in the community. If you have a question, if you don't know the answer to someplace, you don't know where to go, where to turn, or just need basic information, you can definitely give us a call and we can do the best we can to help you out.
Okay, well, thank you, Rebecca. All right, now we're talking here with the Counseling and Psychiatric Services. Now, what is this? This is from the Resource Center. And so now the Resource Center, you have resource centers located throughout the county. Tell me a little bit about what services you provide here, who you are, and what your role is.
My name is Cindy New. I'm actually the program manager at our Personalized Recovery Oriented Services in Jamestown and Dunkirk. I also manage the behavioral health, home, and community-based services at both locations. I'm also representing our Counseling and Psychiatric which we also have in Dunkirk and Jamestown. We provide quite a bit of different services. I'll have Thad talk about health homes here in a second. But at our programming, we look at quite a bit of barriers that an individual has in their life that is keeping them from being successful in everyday functions. So at PROS, which is the Personalized Recovery and Oriented Services, what we look at is if you get rid of all your barriers, what could you do? Who could you be? So we really look at that life role goal and what they want to achieve in life. And that's how we start out. We look at the strengths. We look at what they can succeed in. We want to really be able to take step by step. So that's what we look at here. And we also do medication-assisted treatment at both of our programs. So we have that available as well.
And my name is Thaddeus Lund. I'm the Adult and Children Program Manager for our Health Home team at the Resource Center, which is a care coordination team that works to assist individuals to be as independent as possible in the community.
So we talk about being independent and removing barriers. So we actually mean, so we apply the strengths and the positive attitude to those individuals. So we don't talk about disabilities, we talk about abilities. That's correct. All right, and so now you do a lot of things and with the Resource Center, so not only you provide services to help them acclimate or reacclimate into the community, but you also do things then for home services, is that correct? Okay. And how can someone contact you if they need to get help, if they have somebody that they think might need your service or might benefit from your service? What do they do? How do they contact you?
All right. So we have quite a few numbers. So for here in our Dunkirk area, you can contact for PROS and for Article 31. You can actually call the 366-7660 and ask for assistance or intake. In our Jamestown location, for our PROS program, you can contact us at 661-1510. For our Article 31 program, you can contact us at 661-1590.
Okay, that is quite a few numbers. It is. Well, thank you so much. All right, and so now we have the Team AMVET Suicide Prevention. Tell me a little bit about what this is all about and who you are.
My name is Kevin Madison. I'm the National District 1 Director for our AMVETS organization. Program that was started here in New York. It's 22 every day. It's a veteran suicide prevention and awareness program. We have the Veterans National Crisis Line, 1-800-273-8255, which now, through 5 years of hard work, is our national crisis line. What we provide is a one-number, press 1 for vets, resources of any kind, suicide prevention, drug, alcohol, mental health, hunger, loss of home, being homeless. So the job that I do is get around to all of these areas, and I set up and make sure that I can get the boots on the ground for people to be aware and to help save a life.
So we talk about our vets, and there is no one out there who has worked harder for our country. So this is great. Now, when we have our vets, you say 22 veterans die every day by suicide. How are we helping those? How can we identify those? How can we get them to your number, to your service? What is it that we need to do as non-veterans to help our veterans?
Well, what I've done is in New York, I was able to create a committee of 29 individuals that encompass all of New York State. Additionally, my duties are also of 5 other states. Currently, since I reside in New York, this committee gets out there and reaches out by providing these materials, handing them out to the community so they can get out there. And if they come against any person, veteran or non-veteran, that's going through a crisis issue, they can provide that phone number and be able to get them the help that they need.
Okay, and again, that number is 1-800-273-8255. 1-800-273-8255. And, our veterans, they fought for us. So, and you're a veteran, I take it, right? You're retired. Well, thank you for your service.
Thank you.
Okay, and now we have UPMC Chautauqua. All right, now tell me a little bit. How do you fit in with this, with what we're doing as far as the mental health? And tell me your name and what your role is.
Absolutely. So my name is Marcus Stendal. I'm a program coordinator with UPMC Chautauqua, specifically the Outpatient Behavioral Health Unit. What we do is we provide services within the mental health area, any form of mental health, as well as chemical dependency treatment. So encompassed within that is that we're looking to increase quality of life services in any capacity we can, including sending out services to other people as well as needed, sending out applications to where it's needed. We do work with 2 locations primarily. One is here in Dunkirk. The other one is in Jamestown. In Jamestown, we also have an inpatient chemical dependence facility. We have a long-term chemical dependence facility just opening now, and we're in the early stages of a methadone clinic. And if you'd like to reach us, our numbers for Dunkirk is 664-0018, and Jamestown is 664-8641.
Well, thank you so much. And I know that with the methadone clinic, we're also working on those for here. And I think that it's great because we really can't have enough of the services that those clinics provide because our people really do need it. So thank you. Thank you very much. All right. And we are next at the FSCR. All right. So tell me a little bit. What is FSCR and who are you?
I am Jeannie Galbraith. FSCR is Family Service of the Chautauqua region. We provide mental health services all across the county. We have a school-based social work program. We have office-based for children, families, individuals. We also do house calls for our seniors who need mental health services. We do Hispanic outreach with the Office of Chautauqua County Department of Mental Hygiene. So they reach out, they do translation services, they work with advocacy to get people who might not speak the language to get the services that they need. We also do employee assistance, mental health services. So if a workforce or someone that's working needs mental health, we provide counseling services for them. Yeah.
All right. So now you really work with families. Do you work, and you work from all stages, right? From children all the way up to seniors. The families that you work with, what are some of the problems that you see, which ones are most prevalent?
I would say, we have a lot of clients who struggle with depression, anxiety, some with addiction, but a lot of it is communication in the home, just relationships that they're having, and their big barriers are transportation.
Transportation is a problem for a lot of our people, and certainly to get to these kinds of services, it's not always easy. We have carts, but they don't always get you where you want to go when you want to go there. So, well, thank you. Thank you for being here, and hopefully our families who are in need of services will be able to call on you. So thank you. Okay, we're here with Kasichs. Now, you talk about prevention, and you talk about prevention works, and you have a lot of different things going on here. Tell me a little bit about who you are, what does Kasichs do, and how does someone get in contact with you?
You want to introduce yourself first?
Hi, I'm Amy Beato, and we are with Kasichs, Chautauqua Alcohol and Substance Abuse Council.
And my name's Eric. I'm the Prevention Education Coordinator there. And the services that we have are education, strictly education. Sometimes we get confused with KSAC, which is a counseling credential, but we are prevention education. So we work with school-age students, so from kindergarten through 12th grade. But we also do some work with our community, like working with the adults. If they have any questions about different substances or any of the effects on those different substances, then we can definitely work with them. We also work as a support for those families who may have some people in their family who are struggling with substance use. So they can come into our office, again, get that education, get that support that they need, and we can also connect them with other entities in the community to help them as well.
Okay, so now you say, how does someone contact you? What do they need to do? If there's someone who, you talk about prevention, so would this be for the individual who may be on the early stages of some kind of abuse, and then you give them a skill set to keep them from going any further?
For sure. Yeah, so to contact us, we have two offices. We have one in the Dunkirk office, so you can contact us by phone at 716-366-4623. And then we also have another office out of the Jamestown, and that's 716-664-3608. I had to look back to remember that number. And then you can also look us up online at kasichsweb.org. And yeah, so if someone comes to see us, they're usually on the early end, or they haven't used yet, and they're just looking for information. So if we do find, so we can do like a screening for the individuals that come in. If we find that maybe they do need treatment or need something further than us, then we would refer them out to another entity.
Okay. All right, very good. And now, do you provide counseling if somebody they were in recovery and then they went back and now they're trying to recover again? Do you provide counseling for that, or do you have to send them somewhere else for counseling?
So we would send them somewhere else for counseling just because we are an education agency. We can work with them with like doing life skills, so maybe decision making or setting goals, but anything beyond that, like re-entry into the community, those kind of things, we would probably send them out to another place. We would still be there as a support for them. So whenever we do refer them out, we call it a warm handoff, where we could sit there and contact that agency with them so that they would feel comfortable with, going to that other place. But again, that's beyond our work.
Okay. All right, very good. Well, thank you so much. Thank you for being here. All right, and now we have the Chautauqua Opportunities Health Services. Tell me a little bit, what is your name and what kind of services can you provide, and how do you coordinate? How does all of this fit with all of the other services?
So my name is Katie Knack, and I'm the Intensive Services Coordinator at Chautauqua Opportunities. We are the off-hours mental health provider in the county, so if you call the 1-800 number that Annie mentioned, and it is after 4 p.m. or on weekends or holidays, our team can respond. So all of those calls go into Buffalo to Crisis Services, and they have 24-hour response, but during the evenings, weekends, and holidays, our team can go out and do an assessment. We can facilitate somebody getting to the hospital if that's what's needed. So we kind of fill that gap when the clinics are not available and the regular mental health providers are not available.
Okay. All right, so if someone's calling after hours when the other offices may be closed, if they call after hours, you're the one who gets that call. Is that correct?
Yes, that's correct. We have a team of social workers, peer advocates, other trained professionals, and they work in teams of 2. So if the folks at the hotline decide that somebody needs additional intervention during those hours, they would contact our staff, and we can make a plan to go out and visit someone in their home or anywhere in the community where they may need a response.
So you do home visits as well as having people come in. Do you work mostly with families, with children, with adults?
Our services are very broad. We actually are able to provide services to anybody who's experienced any kind of mental distress. So you don't have to have a diagnosis. You don't have to have a regular mental health provider to receive our services. And to clarify, we do not have people come in. We are not office bound. We only do visits outside of the office. Alrighty?
All right, that's good to know, because sometimes people really do need to have you come to them and may be apprehensive about going into the office. So thank you. Thank you for being available to everyone. All right, and let's see what we have here. We now have housing options, because housing can be a problem. We have a lot of people who are without homes. Tell me a little bit about your names, who you are, and what services you provide.
My name is Jonna Bartley. I am a peer companion, and I work at the Eagle's Nest Respite.
I'm Richie, and I'm also a peer companion at Eagle's Nest Respite, which is actually the program we're here representing today specifically. It is a program of Housing Options Made Easy, which has a wide variety of services that are throughout at least 18 counties in New York State. But today we're here to talk about a little bit about Eagle's Nest Respite.
Okay, tell me, what is Eagle's Nest Respite? What is that, and what kind of services do they provide there?
Sure. So what we are is we're a non-judgmental, confidential, peer-run respite with a person-centered focus on our guests' wellness and mental health. Guests may have a temporary stay of up to 5 days in a peaceful environment, staffed 24/7 by peers ready at any time to assist in their overall recovery. Is basically an essential idea of what we kind of take the traditional, typical concept of what respite is. Typically, it's a place for somebody who's a caretaker to maybe get a break for the weekend and drop somebody off to, kind of get away and have some time for themselves. we kind of flip the script on that. This is a place for the person that is struggling, that is going through some mental health struggle, can come, stay, get a break for themselves, and kind of get some respite for themselves, basically.
Okay, so if there's somebody they just need to get away from the house for a while, get away from the family or the enablers or whatever they may be, they would go to the Eagles Nest Respite. Now, when you talk about other kinds of housing services that you provide, other than the Eagles Nest Respite, and I know that's one you want to talk about the most, but what other services do you provide?
Housing Options has, like I said, it's a wide variety of services. It, of course, started in housing as the basis of the company. So they have housing services in all 18 counties that they serve. Somebody who is struggling in finding housing, who has a mental health disorder, they help advocate for those individuals and fight stigma and fight any sort of limitations they might be facing because of that mental health issue. We do also have as well the STRAW program, which is basically a peer-to-peer service as well, where somebody who is a recovery guide is what they're known as. They meet with people throughout the week and help them maybe make appointments, have somebody to kind of talk to an hour a week, something like that. We did just recently open a new program known as the Alternate Respite. It actually is centered right with us at Eagles Nest. It's kind of an interesting service that we can provide now where somebody can call in and actually have a 1-hour face-to-face video conference session with a peer. So those are a few of our many services.
And how do they contact you? You say they can call in. What number would they call?
Our number at Eagles Nest is 1-844-421-1114. And that's our number at Eagles Nest. And we are available 24/7.
Okay, very good. Well, hopefully that, your service is needed. Hopefully it works. Hopefully people will be calling on you. So thank you very much. All right, and now we have the Hope Advocacy and Recovery for the Mental Health Association in Chautauqua County. Tell me a little bit who you are and what you do.
I'm Stephen Cobb. I'm from the Mental Health Association, and the Mental Health Association, we provide peer recovery supports for people who are experiencing mental health disorder or substance use disorder. And we provide recovery coaching, we provide advocacy for people, and we also provide peer support groups at our location in Jamestown.
You speak of advocacy, and that's true because so many people who are suffering, who are going through issues, really do not know how to communicate those issues. They don't know who to reach out to or what they need to do. So how do you go about providing that service? How do they get to you in order to ask for that?
Right. So people can reach out to us either at our location in Jamestown. If they're not close to Jamestown, they can reach us by phone, and our number is 661-9044. And once they connect with us by phone, we can connect them with a peer recovery coach who can sit down with them and come up with, help them come up with a plan of action to get to a better place. So that might mean getting connected to traditional treatment in a clinical setting, or perhaps getting to the hospital, or maybe advocacy for benefits if somebody needs benefits in order to get medical care. Almost any stated wish that folks in recovery have or entering recovery, we can help them. And we also help families who are supporting people in recovery. It's not just the person with the substance use disorder or mental health diagnosis that needs help, so we can support families also. Our coaches can travel to anywhere in the county, so people can reach out to us by phone and get in touch with us, and we can send a peer out to meet them either at their home or a place in public that's comfortable for them.
Give us that number again.
Yeah, it's 661-9044.
Okay, well, thank you. And thank all of you. Mental health issues here in Chautauqua County, they're right at the top of the concerns that everyone has, whether it's our mayor, our council people, our administrators, whomever it might be. So thank you all for being here. Thank you for providing these services to our residents, to our people in need. We appreciate it. Thank you, veterans. Thank you. And take care. And thank you all for watching City Speaks. You can watch City Speaks daily, 3 and 10 on Spectrum 1301 in Dunkirk, Go to DunkirkAccess.com, watch it on YouTube. Let me know what you think. Let me know what you like. Reach out if you need help. And thank you, and have a great day.